My name is Amy Anaya, and I am a national champion Olympic weightlifter. And I got hurt in 2008, a month before Olympic trials. I'm training to get back onto the 2010 world team, not get back on the 2010 world team, but to get back competing and get ready for 2010. It's hard to deal with a woman athlete who lifts a lot of weight because doctors don't understand the mechanics of the body in that way, and they just say, don't lift. And so to find a doctor who works with football players, who does the kind of movements that I do and gets the impact that I do, was really, I think, saving grace for my injuries. Well, I think the biggest difference between him and other doctors that I've seen, and I've seen a lot, is that he really understands that an athlete needs to get better today so they can train today. Yes, I've been pain-free for 9 weeks, which is the first time I've been able to train strong and heavy since before Olympic trials when I got hurt.
Amy's case is fairly typical. What a number of athletes, whether they're world-class athletes, Olympic athletes, or everyday athletes like me, they'll come to us to try to find someone who will understand the problem, solve the problem, and get them right back to what they want to do. That's important. I don't know anyone who doesn't want to be out of pain right away.
Well, my name's Steve Winauskas. I'm a consultant in the regulatory field for medical devices, and I'm very well acquainted with clinical research methods. I saw Dr. Leahy about 2 years ago after a motor vehicle accident, and I was rear-ended and had tremendous pain from a whiplash injury in my neck. I saw my family physician, David Kahn, in San Jose. I've been very fortunate to be with Dr. Kahn as a family physician for almost 15 years. And Dr. Kahn's own son has been treated as a patient by Dr. Leahy. Up to that point, I didn't believe in chiropractic skills. However, when Dr. Leahy did the first adjustment on the neck, I stopped taking the Vicodin painkillers that I had been prescribed, and I was taking a heavy dose. I stopped. I mean, it was such a relief to have that. And then through a series of 13 treatments, he got my neck back into shape. Today I just came in for a twisted knee, and with one manipulation, it was just remarkable, the absolute relief I got. And it's, non-invasive. There's no pharmacology involved with it. It's just a great skill set that he's got. He's a fantastic healer.
So many people that end up coming to us have had an injury or an accident, such as a car accident, and they've had pain, disability, quality of life has gone way down. And quite frankly, the medications and the therapy that they've done has not cut it. So they're continuing with the medication, they're continuing with the pain, and nothing's changing. So really what our job is to find the exact therapy that will let their body heal naturally. And when you do that, when you hit it just right, it often happens very quickly.
My name is Lynn L. Wiley, and I've been seeing Dr. Leahy for about 12 years. And he's made an enormous difference in my life. I've had back pain pretty much my whole life, and it wasn't until I came to see Dr. Leahy that I really started to get better. Pain has gone down enormously, and it's all due to Dr. Leahy. I thought I would never walk pain-free again, and I was wrong about that after I came to Dr. Leahy.
Like Lynn, many patients that get well quickly may not exactly understand everything that just happened. And what it is the doctor needs to understand the physiology, the pathology, and the biomechanics very well. And once you do, then the problem starts to become simple, and it's easier to solve more quickly.
My name is Lauren Trent, and I came to see Dr. Leahy many years ago. It has to be 15 at least years ago. And I was then racing as a professional triathlete, and I needed constant care because I just trained hard, so I actually had a lot of sore muscles and things that always had to be worked on, and he has helped me get through many races and actually prep for many races when my muscles were fatigued or locked up. He would just release them and I would be good to go before races. Amazing. I've done well in races because of Joe Leahy.
Now what Lauren is talking about is, conceptually, she sees muscle pain. And what it actually is adhesions. Little bits of scar tissue start to form inside muscles and between muscles, and even in joints and around nerves. That presents a problem. You feel pain, you can even get injured. So when we use active release technique, or ART, we can remove those adhesions in that scar tissue. That opens up circulation, frees up the motion, and it actually makes you a little faster and a little stronger. And of course, athletes like that.
My name is Amarjeet Rai, and I have actually followed Dr. Leahy between two offices. He's been absolutely amazing. When I first came in to get treated by him, I was a wreck. I could barely walk. There's no way I could climb stairs, that's for sure. And now in seeing him, I have an option. I can take the elevator, I can take the stairs, and I take the stairs up now to see him. So just that alone is amazing for me. When I first came to see him, I was definitely on a scale of 1 to 10, 10 being horrible. I was very close to a 10. I would bounce between 8 and 10 on a regular basis. And I would have episodes that I was just flat on my back. I still am not perfect. I still have, pain levels, and they fluctuate. But the time in between my lapses are, it's an amazing amount of time now. Instead of being down 1 week every month, it's maybe 1 week every 3 months or 6 months or something like that. And then I come in, I get treated by him, I go on the DRX machine, which has been amazing, and I feel significantly better, and I'm able to do activities. I now have a 3-year-old, which I didn't have when I first started seeing Dr. Leahy, and there was no way on earth I could keep up with my 3-year-old before, but now I'm able to engage with my 3-year-old and enjoy life.
Amarjeet brings up a very good point. A number of people have pain or a disability that they've had for years. Who knows how long? But don't give up. Most of the time there's a solution, and I won't give up. I never do. So we try hard to find that solution and get you back to a normal life. No disability, or at least minimize it, so the quality of life gets better. And for me, that's what this is all about. When somebody improves their quality of life, the pain goes away. I can't tell you how rewarding that is, so that's why we do this.